Hello, my name is Ever Cedeño. My topic is basic implication of clinical observation, nephron protection and diabetic kidney disease. Definition. The kidneys of filters that clean the blood is effective releasing fluids accumulate in the blood at the exit point of the organisms. Kidney damage caused by diabetes called diabetic kidney disease. One video.
The kidneys play an important role in the body. They filter the blood, removing waste products and excess salt and water. If the kidneys become damaged, they falter in their task, causing fluid and waste to build up in your blood, leaving the blood polluted. Finding out that you have early diabetic kidney disease can alert you that your kidneys are in danger. It is important to take steps to protect your kidneys before the problem advances. People who develop diabetic kidney disease usually have no symptoms early on. Diabetic kidney diseases usually cause no symptoms until at least 75% of your kidneys' function is lost, and people who have the condition often produce normal amounts of urine. Doctors rely on tests that measure protein called albumin level in the urine and blood tests to evaluate the level of kidney function. When the kidneys are working normally, they prevent protein from leaking into the urine, so finding protein in the urine is a sign that the kidneys are in trouble. You may be told that you have microalbuminuria or moderately increased albuminuria. That simply means that you have trace amounts of protein in your urine. Key complication of diabetic kidney disease is more advanced kidney disease called chronic kidney disease. This can progress, eventually leading to kidney failure and the need for dialysis or kidney transplantation. Treatment. Keep your blood sugar in the right range, usually with hemoglobin A1C target below 7%. Keep your blood pressure below 130/80, especially if you have more than 300 mg of albumin in your urine per day. Doctors usually recommend specific types of blood pressure medicine for people who have diabetes and kidney diseases. Examples include ACE inhibitors and angiotensin II receptor blockers, also called ARBs, because they decrease the amount of protein in your urine and can prevent or slow the progression of diabetes-related kidney disease. Side effects include possible dry cough, allergy, and a high potassium level. Your doctor needs to check your blood test a few weeks after starting either of these medications. Women who are pregnant or attempting to get pregnant should not take ACE inhibitors or angiotensin receptor blockers, as these can cause birth defects. Lifestyle changes can also help. Limit the amount of salt you eat, quit smoking, lose weight if you are overweight. Even small changes can make a difference. Get at least 30 minutes of exercise activity on most days of the week. Lower your cholesterol, eat less saturated fat. Avoid medicines called NSAIDs or anti-inflammatory medications such as ibuprofen or naproxen, as this can cause kidney damage. Call your doctor now or seek immediate medical care if you have new swelling, blood in your urine, much less urine than normal, or if you have no urine. Thank you for listening. If you like this video, please click the like button, hit subscribe, and ring the bell.
Application in medicine. As for medicine, send the patient blood test, urinalysis, diagnosis, imaging test, kidney function test, and kidney biopsy. And according to that, a treatment scheme will be applied to video.
Type 2 diabetes can lead to a number of complications, including kidney disease. Healthy kidneys play an important role, removing waste products from the blood. Inside the kidneys, millions of tiny blood vessels act as filters. Many substances are too big to pass through the filters, so remain in the bloodstream, while smaller substances, including some waste products, flow through the filters and become part of the urine. Kidney function helps to regulate the amount of fluids and salts in the body and control blood pressure. But with type 2 diabetes, the high levels of sugar circulating in the blood can damage the kidneys and compromise their function. Approximately 40% of patients with type 2 diabetes have established kidney disease. patients begin to lose their kidney function, including their ability to filter out waste, medicines, and excess fluids from the body. The presence of protein in the urine can be an early sign of kidney disease. Symptoms of kidney disease may include swelling due to fluid retention, tiredness, insomnia, itchy skin, and nausea. Kidney disease progresses through different stages as the kidneys lose efficiency and waste materials build up in the body. It also increases the risk of hypoglycemia and type 2 diabetes complications, including cardiovascular disease. The last stage, kidney failure, usually requires treatment with dialysis or kidney transplantation. Many of the medications available to treat type 2 diabetes are predominantly removed from the body by the kidneys. Declining kidney function can affect that process. If the body can no longer filter medications out effectively, the risk of side effects may increase. It may also be necessary to adjust the dose of medication or change medications. As approximately 40% of people with type 2 diabetes have established kidney disease, it is important that healthcare professionals consider the kidneys and the impact they have on diabetes management.
Pros and cons. Pros. The advantage is that for this pathology, there are multiple medications for this clinical picture presented by the patient. Cons. The disadvantage is that if you do not follow the treatment correctly, you are at risk of bringing serious complications to the other organs, such as the heart, developing heart defect secondary to broadly treated diabetes. Next video.
Diabetic nephropathy refers to the kidney damage caused by both type 1 and type 2 diabetes. Because of the growing number of people affected by diabetes, diabetic nephropathy is currently the leading cause of end-stage renal disease in most developed countries around the world. Each kidney has millions of nephrons, each of which is served by a tiny capillary bed called a glomerulus. Watch the full video on osmosis.org.
Use application in Ecuador. UNEMI continuous research on diabetic nephropathy in Ecuador. In Ecuador, field works and carried out the Los Rios province on the condition.
Watch diabetes videos at clearlyhealth.com.
One of the health complications associated with diabetes is damage to your kidneys. Your kidneys filter the toxins from your blood and return the clean blood back into your body. These toxins are then passed into your bladder. The filtering happens inside small blood vessels in your kidneys. High levels of glucose in the blood can damage these blood vessels, causing them to leak. As a result, protein and nutrients are lost in your urine, and some of the toxins remain in your bloodstream, causing serious and possibly fatal complications. A healthcare professional can test for this damage with a yearly urine albumin excretion check and by regularly testing your blood pressure. They can help you find ways to change your eating and exercise habits to lower your risk of kidney disease. By making healthy diet choices, leading an active lifestyle, and taking your prescribed medication, you can minimize your risk of kidney disease.
Conclusion. Beyond medication that control blood glucose and blood pressure, only medication that inhibit the renin angiotensin system have had strong random retinopathy effects. 5 billion.
The development of diabetic nephropathy involves hypertension and hyperglycemia-induced changes in multiple pathways that contribute to morphological changes in the kidneys. The glomerulus is a globular-shaped structure composed of capillaries that are actively involved in the filtration of fluid from the blood to form urine. With diabetic nephropathy, early glomerular hemodynamic changes include hyperfiltration and hyperperfusion, which result in microalbuminuria. Increased afferent arteriole dilation due to a dysfunction in the vasoconstrictive autoregulatory response contributes to increased intraglomerular pressure, which is associated with greater mesangial cell matrix production. Expansion of the mesangial area, an early morphological change with diabetic nephropathy, is caused by greater extracellular matrix deposition and mesangial cell hypertrophy. This expansion is associated with a decreased glomerular filtration rate and a reduction in the surface area for filtration, which marks the beginning of renal failure. As this process continues, the glomerular basement membrane thickens, and this may eventually lead to glomerulosclerosis. All of these changes in glomerular hemodynamics cause stress and strain on the kidneys, which, if left untreated, may result in renal failure.